to serve God and serve others. So I thought of this picture, Paul en route to Damascus. And at this point, his life was changed around, right? I mean, he went from basically Saul to Paul, from bad to good, from not wanting to serve God and not having anything to do with God to wanting to serve God. But that had to come about in a big way, a sudden way. And if you read the passage, you would see that he became blind. Now, medicine is very clear, especially internal medicine. We have various diagnostic criteria. And when you talk about stroke, it's a sudden neurological deficit, meaning a sudden loss of a function that the brain provides. So you could actually say that, well, Paul had a stroke. Whatever the pathophysiology was, it was spiritual from God. But I'm sure God would have had to provide some blockage of flow to his eye supply to cause that blindness, right? So a stroke is a sudden interruption of flow of blood to the brain, and it leads to that physical sign of loss of the ability to walk, to talk, to feel well and normal, to maintain your balance and all of these things. And you might have met persons with strokes, right? There are two types of strokes. So they would tell you that, you know, I didn't get a stroke where there was bleeding in the brain. And many relatives, when you tell them that, they breathe a sigh of relief, because usually the stroke that is as a result of rupture of a blood vessel and there's blood in the brain, many times is associated with a bad outcome, right? But it doesn't mean that the other type of stroke where there's just blockage is good, right? I mean, a stroke is a stroke. You still would have loss of function. And certain strokes can lead to massive and irreversible areas of loss of brain function and loss of brain tissue. And notice I say irreversible. So the main risk factors, and we actually did a study. Those of you who know Dr. Dalrymple in St. Patrick's, we had done a study many years ago where we realized those persons who had stroke, these were actually the risk factors. A lot of them were hypertensive, diabetic, heart disease, and they had high cholesterol, right? We did not get to check the weights of those patients, but I'm sure a lot of them were overweight. Now, at the end of this presentation, what I want you to go away with is this acronym, B FAST. Now, before it used to be just FAST, where F is face, facial drooping. So one side of the face is dropping. You wake up one morning and you watch yourself in the mirror and you realize, The arm, so weakness in the arm, speech difficulty, right? And speech is two ways, the ability to understand what is being said to you and the ability to speak, right? And make speech. And it could also be that it's just slurred. And we talk about time is brain, time is muscle, time is of essence in any situation. So now we are fortunate to have health facilities all over the place where we can get urgent treatment and just go and get sorted out and be seen. But they added on B fast because we recognize that sometimes persons just have a change in vision, right? And it might not be complete loss of vision. It might be loss of vision in one eye. It might be that you're seeing a hole, right? You're able to see around the center, but you're seeing a hole, literally a hole. It might be blurred vision, and it actually might be less than an hour or a minute, but it doesn't hurt to go and get it checked out, especially if you know you have the risk factors. And again, loss of balance. Loss of balance might be an unsteady gait. It might be dizziness, or it might be what we call vertigo, where you're spinning around the room or the room is spinning around you. And don't put it down to the heat or I'm not drinking enough water. Many times we have persons that come in for a simple headache or something arbitrary, and somehow we do a CT scan and we realize that they had a stroke before, right? So While women, it's said that women had more risk of stroke, it may be that women are more inclined to seek health care. If you notice in this picture, the symptoms are basically the same, except that with women, it might manifest as just feeling weak and confused, not being able to remember something as simple as your name or where you live, and nausea and vomiting. And that also might signify a heart attack, the nausea and vomiting, because if there is a loss of pump function in the heart, then there's loss of blood flow to the brain. And again, that's the whole pathophysiology of a stroke, right? So medicine is very simple with basic definitions. And the next slide just talks about other things that I've spoken about, right? So remember, be fast. So you can write that down because I'm going to ask somebody after. So there are long-term effects of a stroke. It could be, fortunately, some persons may develop what we call a transient ischemic attack, which is just you have symptoms for an hour. Now, when I was beginning medical school, that definition had said 24 hours. If you resolve within 24 hours, we don't call it a stroke. But now it's changed to 1 hour, because what we realize is even those persons who were able to have return of their function by the next morning, we still need to be aggressive in our treatment to them and towards them and follow them up aggressively, because some of these persons may come back the following week. So the definition has changed. Once your symptoms occur for more than an hour, we call it a stroke. And again, it's still serious, because even if it was less than an hour, it can happen again. So you have physical changes. Now, the severity might vary. Some persons might have just a mild loss of power, probably a cup dropped from their hand. Some persons might have severe weakness where they can't move. Some persons might be driving and they realize the hand falls. Some persons may have loss of sensation. Again, difficulty with speech and swallowing and eating. Spasms, or you might have seizures or jerking, and the long-term effects can cause pain, because as the nerves regenerate, you may get pain, you may become spastic, very stiff, and you may also have insomnia, because the brain is now trying to regenerate all of these nerves. Again, communication is a problem. You might meet somebody with a stroke and the speech is so varied, so they may understand what you are saying. You might be able to tell them, open their eyes, close their eyes, stretch out their tongue, and they listen, but you have to slow it down. So they can't have multi-step commands. It might just be that the speech is slurred. It might just be that they mix up items. So you give them a pen, and they know it's a pen, but they keep calling it a dog. So they might say, pass the dog. And then you as the relative have to now learn what it is. And you can make signs for them as well in the house to kind of, they might pick up a picture of a pen and say, okay, this is what they want. So when they go home, the therapist would better advise you as to how to communicate with these persons. And it can be difficult. I was examining a patient on Monday. He's 45, very overweight, right? And hypertension. Well, of course, he didn't know he was hypertensive. And now his power is like a grade 1 out of 5, barely can move. And of course, during examining him, he broke down in tears. So a lot of them that can continue and they can become depressed. So support is so important, right? So trouble understanding what others are saying, trouble reading, trouble writing. And these are things people might overlook and say, okay, I'm getting older, it's probably just a moment, but get it checked out, right? Of course, it can result in memory impairment. And this is actually a cause of dementia, right? So we call it vascular dementia. It's not just Alzheimer's is the only cause of dementia. Difficulty in learning and grasping new concepts, mixing up information. So what we have recognized is now that we are seeing persons in their 30s, persons in their 40s with stroke. And of course, now you have to be writing these persons up for disability, for NIS. And of course, their work would have to replace them with somebody that can function. So a lot of dependence now on disability grants. And of course, the emotions and the personalities, depending on which part of the brain. So many times it's the front part of the brain, they can become very aggressive. Their whole personality changes. If it's the side of the brain, it might just be that they can't calculate, they can't feel, they can't count backwards anymore. They might not be able to spell their name, and certain things they might not be able to tell right from left. It can be very interesting. And this term pseudobulbar has to do with involuntary expression. So you might smile when you're not really, or you might actually cry when you're not really sad. And you would have involuntary movements of the oral cavity, the swallowing again. So if you have a stroke, and this is good to know, because when you go to the hospital, you want to know that you got investigated. If you have those symptoms, you want to know that the doctor did an ECG, they did blood tests, they did a CT scan, they checked your swallowing, and they did an ultrasound of the neck. And depending on how severe the stroke is, and how young or old you are, and if whatever they see on the ECG, they may have to do an echo. And at least, thank God, these things are available between Roxborough and Scarborough Hospital free of charge, and it's routinely done. So it's good for you to know what should be done. So depending on what is the type of stroke, of course, if it's a bleed, we would not put you on blood thinners. And if it's the one where there's just clogging, then we'd put you on blood thinners, sometimes 1, sometimes 2. So again, it's good for you to know so that you ask questions. Sometimes mistakes are made and you want to be on top of things. There are different types of therapies. So there's physical therapy, there is speech therapy, which actually talks about swallowing, speech, and behavior. There is occupational therapy to get you back, not into your job alone, but even retired persons have to be able to climb the steps, be able to function at home. You might need to make modifications where probably you have to make a slope instead of the step. Probably might have to attach PVC bed rails. So your ability to function at home, cognitive therapy, being able now to sort out things in the brain that are like calculation, or being able to process the chores that you need to do or the errands that you need to make a list for those around you, and of course behavioral therapy. Many times behavioral therapy is covered by speech and occupational, and cognitive therapy is actually under mental health. So when you get a referral to mental health, don't think it's because the doctors think that you're crazy, right? It's just, again, cognition has to do with higher level function in terms of calculation, being able to do chores and errands. Many persons after a stroke are not able to perform simple activities of daily living, such as taking a bath, brushing their teeth, combing their hair, just grooming themselves, and even higher activities such as being able to send somebody down to the road to sign a, or go to the bank to sign a check or pay a bill. So it's definitely an intrusion of your life. And of course, lifestyle changes. You have to exercise. Nutrition is important. A lot of times we discount nutrition, but it's very important. And if the person has difficulty swallowing now you have to come up with ways of how can we get them to get that nutrition in a soft or puree way, because at least protein you could get at any form of split peas. Doesn't always have to be hard meat. Fish can be mashed up and pureed as well. You don't even have to get a machine. Sometimes you can just mash these down, and you have different, now there are so many ways of pureeing everything and getting it down to powder form. There's a simple blender can turn oats into a powder, and you can mix it with a bit of milk and still make something healthy with all the food groups in it. And of course, quitting those activities that lead to bad health. And probably that's another reason why we are getting so much strokes in the in the 30s and 40s. Another thing that wasn't mentioned before is with females too, those who have things like lupus, heart disease, born with a hole in your heart, or a certain infections can lead to stroke, because it's not just the clog itself is not just cholesterol clogs, but it might be different proteins that attack the blood vessels. Migraine too can cause a stroke as well, because it's inflammation of your blood vessels. So a lot of times young persons in their 20s can get strokes. We have to rule out if they have lupus. It might be related to a migraine. And again, they may have a problem with their heart, right? So bear that in mind. I also met a patient who, she had severe menstrual bleeds. She wasn't really sorting that out. Her blood count dropped, and as a reaction, her platelet counts increased. And because of that, she threw clots to the brain. So severe anemia that results in a reaction of the blood vessels to increase the clotting factors can also result in a stroke, right? So we want to exercise, limit our risk, keep our risk factors under control, or diabetes, or cholesterol, or blood pressure, and we want to quit those unhealthy activity. Now, notice the definition of exercise here is 30 minutes a day for at least 5 days a week, or if you're going to do 3 days a week, it's 50 minutes and not more than 2 days should pass in between. So you can't say exercise Friday and Monday. You have to put another day in between. And even if you are a cleaner or a security officer, it's planned activity outside of your regular activity, right? So you might think you're a teacher and you're climbing up the steps and the children have you active. No, it's planned activity outside of your routine activity. So again, we are serving others, right? So now the patient is at the center, but you have that core around you, the family, the community, the nurses, the dietitian, the therapist, the priest, because there's spiritual health as well, the persons in the church, the mental, the psychiatrist, the social worker, the employer, the employee. It's a whole network of people. So you have to think about when they come home, there's nursing care, physical care, speech care, and sometimes you might have to stick up signs. Sometimes you have to remind these persons what is the date. So you have them listen to the radio, watch the news, keep the place active, have their grandchildren around, friends that they like. It's really like, you know, twice an adult, twice a child, once an adult, right? So you're getting them back slowly. Cognitive therapy, reading the newspapers, informing them of the dates, and having them draw. There's art therapy, music therapy, there's acupuncture, there's ice heat therapy, ultrasound therapy, so many things, but the therapist would decide. Going to the beach as well, and behavioral therapy, because they can become very anxious, depressed, traumatized, because they would have been in the hospital away from home. They might have seen somebody next to them die as well. And brain stimulation games, having the ball, puzzles, coloring helps, right? So I am going to move straight into cancer, and then I can take questions after. So with cancer, there's this acronym, CAUTION. Tells us about signs to look out for. So change in bowel or bladder habits, and bowel, by bowel we mean colon cancer, bladder, even prostate cancer, so your urinary pattern, a sore that does not heal, unusual bleeding or discharge from anywhere, whether it be vaginal, from the bottom, and even from a lump that you had for years, change, thickening in lumps of the breast or elsewhere. And sometimes these lumps can be even under your foot sole. I mean, Bob Marley had a melanoma on his foot sole, right? And that progressed all the way to his brain. So you have to know your body. Indigestion, difficulty swallowing, change in the warts or the moles, and a nagging cough or hoarseness, get it investigated. So you realize that your body is a temple of the Holy Spirit, and you should take care of your body. God gave you that body to care for, just as you would care for a child or a plant or a pet, right? So we talk about prevention of cancer, avoiding smoking, and now we have a lot of patients doing vaping and electronic cigarettes, but all of these can cause cancer, probably even more so, right? And smoking can be cause cancer elsewhere. And you see the healthy diet coming in and your healthy plate coming in as well. Exercise regularly, and not just aerobic activity, but even as we get older, you want to put in the resistance training with the weights, right? You know, because it encourages flexibility, and you know, as we get older, we lose muscle mass. So you still want to lift some weights twice a week. This can be canned peas, this can be a simple water bottle, the 500 mils filled with sand. You know, I gave my mom some weights to do. I don't know if she does them. I put them on her bed for her to do them at least twice a week, up and down. So as we age, that is important. Again, avoiding obesity, limiting alcohol. Now, recently, the World Health Organization has now said that before occasional drinking and moderate drinking was okay, but now they are saying that even occasional alcohol may be associated with certain cancers like breast cancer. So what they are saying is, if you could avoid it, that is best. Or if there is an occasion that you choose, say it's your birthday or Christmas, okay, choose your occasion and you stick to that, but you still don't go and binge drink, right? So I wouldn't choose to go into what is moderate drinking. I'm saying that, you know, it would be best to avoid it, or, you know, side of communion, or choose your occasion, right? Avoid unnecessary radiation. Like, so I'm not saying that every time you have a flu, you're going and ask one of your friends in the medical facilities to do an x-ray, right? Limit exposures. You know, a lot of times around Christmas, we tend to mix ammonia, bleach, and all of these things. You don't know what harms they may have on changing our cells. Certain infections can lead to cancer, so HPV, human papillomavirus, for cervical cancer, hepatitis, for liver cancer. There was something I was saying. Oh, and vitamin D supplementation. At least in the Caribbean, we are blessed in that we have the sun, right? So we have natural vitamin D. And you would see a lot about it in the cable TV, mostly in those European and US countries where they stay inside and they don't really get sunlight. So it's only if you are confined inside, like in a nursing home, and you don't have access to an open window, it becomes important for us to test the levels and to supplement with high levels. But even in a nursing home, they should try to open the windows and let persons get natural sunlight. Again, we're talking about quality sleep. So we spoke about these signs, but this is just a pictorial representation. Weight loss. Now, many times as you get older, you may lose weight, right? But if you find that your clothes are quite big, you know, go ahead and check it out. Skin changes again. Just always feeling tired, no matter how well rested you try to be. Unexplained pain. You can't explain this pain in my back, especially back pain in men, right? It might be signs of cancer that has spread to the back. Unexplained bleeding, right, from anywhere, bowel or bladder change, and that constant cough, get it checked out, right? At least, you know, we have free healthcare where you could get things checked out. So specifically, the most common cancers are colon, prostate, breast, and cervical. Recently, we've been seeing pancreatic cancer, and that's because of the association with alcohol. So you might have jaundice or dark urine, yellowing of your eyes. And you might see lung cancer, again, with smoking, cancer of the throat, cancer of the skin, as well. So with colon cancer, it's changing bowel habits, whether it be diarrhea or constipation, but especially if you see blood, get it checked out. You always feel bloated, get it checked out. Cramping in your rectum, especially if you know you're over 45, get it checked out. And of course, we always say your health is your wealth. You go to the public system and you find you're not getting any sort of attention, invest in your health, invest in screening. Our men and women need to be aware of this as well. Urinating frequently, they're spending a long time in the washroom, there's dribbling, there's pain, blood in the urine, burning, difficulty urinating, you have to wait, or even after you pass urine, there's dribbling. Breast cancer, you would know your breast the best. So changing the nipple, changing the skin, nipple discharge, especially blood and a lump, check for it every month, especially if you're below age 70. And after a few days after your menstruals, you can lie flat on the bed with your arms above you and you feel your breast. And again, you put your arm on your waist and you feel one side, and then you go to the next one and you feel under your arm, and you make this a routine examination after a bath every month. Cervical cancer, bleeding. Now, even after menopause, if you see any bleeding from the vagina, please get it checked out. Abnormal bleeding and discharge, get it checked out. You're not supposed to have blood after you've passed through menopause. And again, we can't forget our men. So we are talking about screening now. Now, usually, now they have a blood test called the prostatic specific antigen, the PSA, and you can get a blood test for it, and it's really from age 50. You can get that at the Blue Room up at the fort. And if, however, you have a strong family history of those first-degree relatives below the age of 40, you might want to start earlier, like 45. But again, be aware of the signs, because I have seen men in their late 40s get prostate cancer, and with them, it can be more aggressive. So, and you know, that's the reason why sometimes you don't want to be too secretive within your family about illnesses, so that persons would know, okay, I should look out for this. If I see this, I should really check it out, right? I'm not saying you're going to put your personal health business on Facebook, but certainly if you know you have a sort of cancer, it's wise to at least let your first-degree relatives know so that they can check themselves out, right? Because you can't change your family history, but you can change you getting up and getting screening. So for breast cancer, for you really should, and this is MH, mammography should start from age 40. Now, again, when I started medical school, they had said about 50, then they changed to 45, and now it's really from age 40. Because again, we are seeing persons 41, 42 with breast cancer. I keep seeing it all the time, right? Especially of Afrocentric origin, right? And now it's done with an ultrasound. You can do your mammogram at the hospital. You can do it at Dr. Tam's office, called the Hall Medical. You can go down to Trinidad, Pink Hibiscus Suites. A lot of insurance covers these now, and it's not that expensive anymore, right? With colon, again, from age 45, again, it used to be age 50. It has changed because research has shown persons are getting diseases in their 40s, right? So there is the fecal occult blood test, or I like to say FIT. That test, though, it's done on the stool and you have to do it every year. It actually costs 100 TT at Tobago Medical Lab at Rollocks Building in town. The colonoscopy, which you can get at the hospital, although at the hospital they would not offer screening, but I know it's done at Calder Hall Medical. You can get it in Trinidad as well, Dr. Henry, Judith Henry, Dr. Bartholomew, West Shore. And again, with that one, it's a camera test. It's a long tube with a camera and a light on the end. It's stuck up your colon. And at least with that one, it's every 10 years. And now there's CT colonography available privately in Trinidad, where you swallow a pill, and it's a video endoscopy. It's in a capsule, and you would get a picture. The thing with that is, if something is found, they can't really biopsy it, you know, whereas with the colonoscopy, it offers you the benefit that if something is found, you could do a biopsy one time. And with cervical cancer, age 21 and above. So you should be doing your pap smear every year, at least for the first 3 years, and then every other year till about age 70. And mammograms can stop at age 70 as well. Now, there is this thing called a pap test, where a pap smear is done and they actually test for the HPV virus on that pap smear. And with that, you could get away with every 3 to 5 years. Again, that particular test is more done privately, but it's something you can do now and then just to be sure, especially if you have a family history. So in terms of risk factors for cancer, again, family history, poor dieting, a history of alcohol abuse and smoking, a history of obesity and just unhealthy habits. Right? And there are certain family conditions where some family members are born with polyps and inflammation in their bowel, inflammatory bowel disease, Crohn's disease, ulcerative colitis, and cancer, because they were born with those sort of abnormal colons that were very inflamed. But most cancers can be picked up early if you do the screening. And of course, you have that acronym I spoke about, caution. Any change, you check it out. Or just from, you know, age 30, every year for your birthday, go and get an examination, right? You know, that's something I try to do. So you would find me by my doctor on my birthday, right? Trying to just get a checkup. Right, so this is just a summary: mammogram and breast ultrasound over age 40, PSA over the age of 50, that's for the men, colonoscopy over the age of 45, or if you're going to do the annual fit test on your stool and your pap smear from age 21 up to age 65. Mammogram is up to age 70. So let's stop for a bit, and I can answer questions, or persons can make comments. Can anybody remember what B-fast is?
Yes, balance is off. Eyesight,
right,
is probably good. Face drooping.
Very good.
Okay, I need help here. I'm not sure about
the arm,
speech. Oh yes, the arm, slurred speech, and T.
T was just time. Get to the hospital.
Oh, on time. Okay. So you said sometimes you can get a stroke and be okay and continue life as normal. Because like one time I know I was sleeping and I heard like if something break in your brain, like it's just hearing a loud packs. But then you know it's happened in your head. Like something trigger off, something make a noise like it burst. But then you're okay after a while.
But would you have had any of those symptoms, such as loss of balance, loss of speech? Because sometimes that could just be a headache a simple headache like tension headache, or you have cluster headaches.
I
So
just
yeah,
realized my voice is like this for a while, but then my occupation is a teacher, so I don't know. You know, you don't. I know you say check
right.
on your health
So
and
yes.
complain, but then
So
you
so
may label
which
you as being paranoid. You know.
yeah. So with speech too, it's not really hoarseness, right? So it's slurred speech. So you're sort of talking like that. Or it's the ability not to speak, or the ability where you can speak, but you are mixing up items, and or you're not able to have that speech input, you're not able to obey instructions. But hoarseness, no, not
Okay.
hoarseness of their voice. But again, teachers talk a lot, during the day, so they would have hoarseness. And again, that would come into more like when you retire. If you find it's continuing, then and even after you stop teaching, then you could get that checked out.
Okay.
So I want to ask another question then. What are risk factors for stroke? Can somebody else answer that? Risk factors for stroke. So I'm seeing Mr. Caesar. I'm seeing Mr. Caesar on. Brother Errol Caesar. What sort of diseases you have to have, or you could have, that could lead to a stroke?
High blood pressure.
Right, high blood pressure, high cholesterol,
diabetes,
diabetes,
even obesity.
obesity, high cholesterol. And we said in those young persons, sometimes even something like lupus or migraines or abnormalities in your blood cells. Even sickle cell could be a risk factor as well. So more the young persons. When I say young, I mean below age 35. Okay, I have another question. What are some of the things that you have to think about when you're caring for somebody with a stroke? And that's good to know as parishioners. Anything you have to think about, or what could change and for them? What did I discuss?
Environment, physical environment will change.
Right, so their physical capacity changes. What else can change? Speech, the ability to swallow as well. You have ever gone to visit anyone and see them with a tube down their nose, and the relative has to do smoothies and throw their food down that tube? Probably you would have visited somebody in the hospital and seen that tube, and nasogastric feeding tube. And sometimes it's temporary, because as they recover, the back of the throat heals and they're able to retain function. Sometimes they get the tube directly in their stomach. So their emotions can change. They can be very depressed. They can be frustrated. Their personality can change. They can develop dementia. So we mentioned that. So what about cancer? What are some of these signs? And I would really like the men to answer. What are some of these signs of prostate cancer?
A burning sensation
in the urine.
in the urine.
Yeah, Brother Hector, what are some of these signs?
Dripping of urine
Yes.
After you,
So change in your bladder habits, your urinary habits, and any probably blood in the urine. Sometimes, now I'm seeing patients with renal cancer, kidney cancer, cancer of the blood, so they might feel very tired as well. And so I would really like a man to answer, when would you screen? What is the test for prostate cancer, for screening? Screening is doing a test, not because you have symptoms, but probably because you have arrived at that age. So at what age and what's the test for prostate cancer?
So I think generally after age 40, you start doing 40, 50 about. I think you could do the blood test. You could do the blood test.
What's the name of the blood test? What you're going to ask in the blue room?
I can't remember.
So the PSA.
PSA, right?
Yes.
Yeah. So they check, right? So that, and I think sometimes they have to do the physical examination.
Yes, they might have to do a rectal exam,
Mm-hmm.
but sometimes, at least with the PSA, you could pick it up before. That's the good thing. So what about breast cancer now? What are some of the changes you would see? What would make you suspect that you have breast cancer? And breast cancer can happen in men. I have seen men with breast cancer, very rare. And the men I've seen, it did not do well. It was very aggressive. I actually saw an elderly gentleman at age 60 with breast cancer. What are some of the signs of what changes you would see?
Changes in the shape and the size of the breast.
Yes, the skin lumps, bleeding in the nipples as well, right? There is a type of breast cancer, very fungating, where the skin just opens out like a sore. And I've seen persons in Tobago cover it with leaves, and they dress it with soft candle, and they're thinking it's a sore or some spirit, or some people just think it's a sore. And that is really a cancer, and that's a very aggressive cancer. Call it fungating. It's smell and all of that. And you might not even have changes in your breast. You might have a lump under the arm, right? And again, look out for bone pain. Sometimes cancer presents itself already spread, unfortunately. Because sometimes we work so hard and we put the fatigue as just hard work, but it's really cancer, especially cancer of the blood. Again, we are seeing that on lymph nodes. We call them wax and cannon. And again, when would you start checking for breast cancer, screening for breast cancer? At what age?
Years.
40 to 70.
Yes. So you could start off with your mammogram and your ultrasound, but of course, even before that, you have to learn your breast. So you start from the time you become an adult, you start feeling your breast, so you know what is normal, because some lumps, especially young persons, they are normal. But let's say your mom had breast cancer at age 45. You would start screening 10 years before at age 35. So it's good to note that. And it's good to know that because, again, you can inform somebody in your community or in your church, listen, your mom had breast cancer at age 50. Have you gone to check as yet? Right? Because sometimes we want more listen to persons in our church than persons at home or even the doctor, right? So it's good that Father Charles chose to have, education on health so you could really serve others. So cervical cancer, again, from age 21, doing your pap smear or your pap test. The good thing is that all health centers do that. So even the men encourage your partners to do it. But I want you to know the names, because oftentimes I ask women, did you do your mammogram? And they ask me, what is that? So, make yourself aware, educate those around you. And what about colon cancer? What are some of the signs?
colon cancer can present with a dry cough and stuff like that.
Well, weight loss, the cough can be with lung cancer, or sometimes cough will be if you have a cancer somewhere else and has spread to the lung. But with colon cancer, which is the bowel, the gut, you might have blood in the stool, weight loss, or constipation or diarrhea, right? So you do your colonoscopy, or you could do the stool test, the FIT test every year. And of course, from age 45. Right, so I just wanted to mention a few more things, just in 1 minute, just to let persons know that palliative care means improving the quality of life of patients with serious illness. If you hear your doctor mention the term, it is not that they are giving up on you. They have just recognized that you have a serious illness. They have recognized that it's advanced and you have symptoms, and they just want to improve those symptoms, like the same cough or weight loss and working on your nutrition. So it's not that the intent is not curative, but when they start using terms like end of life care and hospice now, then we know that you are entering that phase, or you have a relative like that. And that's not when you want to be closed. You want to put plans in place. You know, you call your priest and you rally your support, right? So you could be comfortable, or the person around you. And again, there is cancer treatment in Tobago. At least there's chemotherapy. We don't have radiation, but efforts are made to support the patient and provide vouchers for travel. We have, although the MRI machine is not working, hopefully they're in the process of purchasing one. Pediatric care, the children have to go to Trinidad still. We don't have some of the tests to determine the type of breast, or if it will react to certain medications. Sometimes they have to be done privately. This is one of the pioneers of palliative care for cancer in Tobago. So this brings me to a close of my presentation. I really tried not to take more than an hour, but I hope that you can definitely share what you have learned, internalize it, and also those things we spoke about, the healthy plate, the exercising, limiting the alcohol and the smoking, educating those around you, getting your sleep, and you know, can help you to impact on your spiritual health, your physical health, so that you can serve God and serve others. And I actually just did a book on the healthy plate. It's something that I'm very passionate about, because we don't do a lot of that. We tend to kind of fill our plate with the rice and the bus-up shot, and then put a quarter for the channel, which it should be the other way around. So, you know, just be mindful of that. That's so important in your healing, right? So thanks for the second, Father Charles and St. Mary's. And for those who joined in. Oh, okay. So what I would say is, as I said before, do the treatment that is recommended from the medical fraternity. Talk to them about the alternative treatment to make sure that it doesn't interact with the chemotherapy. Once it doesn't, you can continue, but still do your cycles of chemo, radiation, immunotherapy, whatever they recommend. And then you talk to your doctor to make sure. So I usually welcome patients, you know, bring in what you're using and we could talk about it, but I wouldn't see you using that alone, because I've seen where persons use that alone, especially young persons. And, you know, sometimes it's the persons in the church that tell them to use it and not go to the chemo, right? So, you know, you know, I believe that sometimes God that guides doctors. So I wouldn't say that just ignoring what the doctor says is the way to go. So do the treatment that is recommended, discuss the alternative, and you could do that simultaneously. Right? Okay, Mrs. Grant.
They're just comments from listeners online here who take the opportunity to thank Miss ROSLYN,
No problem.
Dr. ROSLYN, I should say, for a very informative session this evening. You know, it's truly enlightening, and we hope that we can have more sessions like this, you know, in future.
Yes. You're welcome.
Mhm. Mhm.
Take care, everyone. Thanks, Madam Shakir.
Thank you.
Blessed night
Good night,
to everyone.
everyone. Blessed night, everyone. God bless you.